not final. Failure is not fatal. It is the courage to continue that counts. My name is Nisha Masroor. I am the Corporate Communication Executive. Today, we have a very special guest, Mr. Binu Joe, who is an author, academic researcher, gold medalist in M.Sc Nursing Pediatrics, and also principal cum professor in Christ College of Nursing, Rajkot. Welcome, Mr. Binu Joe. So, sir, we will start with the very first question. Tell us something about yourself and why you have chosen this field.
First of all, a very good afternoon to you, ma'am. Thank you. So, I am Binu Joe, myself Binu Joe. I have completed my PhD in nursing, and my study on the PhD was related to nomophobia. So, where we say that yes, this world is full of mobile phone fear. So when we live without mobile phone, there is a lot of fear. So that is what was my PhD study. I completed my MBA in hospital administration, and that too in distinction. I did my UG in nursing. Again, I passed there also in distinction, and I was a second rank of the Rajiv Gandhi University of Health Science. I did also naturopathy and Unani yoga course. It's a diploma course from the Mahatma Gandhi University, a centralized sponsored university from Delhi. Basically, I belong to from a native of Kerala, and now presently working in a Christ College of Nursing. Initial background of administrative post I am doing here. I did from the foundation. I am here from the college laying stone. I am working from this institute. So from the basic foundation, I am working in the Christ group of institution in Christ College of Nursing.
Sir, why have you chosen this field?
A very good question. Actually, I am basically from a nursing fraternity. I belong to a village in Kottayam district, which is a native of Kerala. And as we all know, there are majority of Kerala nurses across the world. So in all the peoples of Kerala, the blood in nursing, blood is there. Actually, my all family members are from a background of nursing community. As we tell, the first nurse is mother, because mother nurses the child. So if my mother is a nurse, of course I joined the nursing community.
Sir, are you doing any research right now?
Yes, of course, I'm doing a research. I have 104 students are there under my PhD. They are doing in universities, and here my two UG students are doing a PhD research studies. So basically, one of the research study which I would like to share is that my students are doing a research study on the parameters, like a patient who comes in the hospital, what are the parameters to adjust to these OPD routines. See, when people enters the hospital, they don't know where is the water facilities, where will be the blood bank, where will be the pharmacy. There are a lot of queries. So we are just doing a study on patient satisfaction when they enter the hospital. That is one of the study which is undergoing in our college.
Sir, as you are the gold medalist in M.Sc Nursing Pediatrics, so please tell something about the challenges. That what are the challenges faced by the nurses?
Yes, of course. When we have a dream, learning is a lifelong. So when we have that habit of reading continuously, when we have our own motivation and interest, if we have our own motivation and interest to learn something, even if we have much number of hurdles, we will try to overcome. So we should not fear of hurdles. We should think it in a positive way and face the challenges. That was my style of teaching. Always I will learn practice more. Yes, we have difficulties, but if we practice more, the difficulties we can overcome, and success also can happen.
We have seen mostly female nurse in this field. So is it good for male also?
Actually, first of all, we should think a uni-nurse concept. The concept of uni-nursing has been evolved. A uni-nurse, which I want to tell, is that uni-nurse is a nurse who can enter in the nursing field who is a male and female. So rather, if you think it is a uni-nurse concept in nursing, then it will be good. Yes, of course, males can also work together. We can. That is only my policy. So if we are together, so it's best. Rather than doing this bias, it will be always, we should think it in a positive way It's a uni-nurse concept where both the males and females can come into this profession, and it's a concept of an unbiased gender. So actually, I'm working in this setup from the last 25 years, and I have not felt it. Is there any difference between if he does not feel? If when our motive comes, like I will tell an example, when I entered in a UG undergraduate, we were 15 boys. That too in 98, 15 boys, it was very, and suddenly somewhere come with parental force. See, after 3 months, what happened? Around 8 boys gone. So we were left only 7 boys. So from the mind setup of our 40 students, in that 15 were males. So in 15 males, after 1 month, if 8 students goes, what will be the mentality of other 7? Yes, we had that challenges, but we had overcome. We did not felt it like that. We said, I personally did not felt it, and we did continuous studies. So it's more of a uni-nurse concept. When we feel it is a uni-nurse, there is no difference between a male and female nurse. Then we will work together, and we will not come across that mentality, I think.
All right, sir. So most people think that nurse and compounder are the same. So what is the difference between a nurse and a compounder? Is there any difference between them?
Yes, actually, what like compounder is a tech word. Compounder is a person who makes the actually who prepares a medicine, and then he prescribes to some patients. So actually, compounder is a person who mixes different ingredients from medications and then may prescribes to some patient. Whereas nurse's main role in cases of an emergency, we can prescribe the drugs, but our main role is in the administration of drugs. Whereas nursing is a professional course, whereas a compounder can be learned, he can by practice. Like if a person works under a doctor or a pharmacist, he can slowly learn that. But he has not undergone a professional training. Maybe he has not undergone a professional training. That is another difference. And then nursing is we have a registered council. Our registration number is there. I am registered to practice. I am a license holder, so I can register. I have done my registration, and I am a license holder. Whereas a compounder may not be a registered person and who is not having a license. So basically, it's a difference in the nurse. And there are some states previously they used to tell the male nurses were told as compounders. Some states of India where they used to tell compounder is a male nurse, but no, compounder is a different word and nursing is a different field.
All right, sir. You have explained very well about the difference between a nurse and a compounder. Sir, what message do you like to give to the nursing students?
Yes, that really I was telling nursing students, they should think that learning is lifelong. Creativity is the need of hour. If everyone learns in a same way, some teachers comes and they teach in a classroom setup and they just mug up and complete it. That will not. You have to build your own creativity. Creativity is the first step. If they have an inner creativity and inner motivation to learn, they can learn anything. So creativity is the must. Then learning lifelong. When you stop that, because our cells are also growing continuously, we tell that growth stops, but development is always continuous. So till from the womb, from the mother's womb to the tomb, development goes on. Whereas the growth stops after 15 years or 18 years. When adolescent reaches, your height and weight may not that much fluctuate, but lifelong development goes. So a nursing student should remember there is no full stop. When you keep full stop means you get tired of. So there is no full stop. You can rather it is a sea like knowledge is lifelong creativity, and try to bridge the gap between the knowledge and practice. Sometimes what happens, we have learned many things, but there is a difference in practice. So actually why we learn nursing, we have to help the community. Our main goal is to help the patient care, help the society. If we learn maximum and then we don't practice, the use of that knowledge is nil. Knowledge is gained to help someone or to give someone or to practice in someone. So nursing students should remember they should not develop attitude. If you are a rank holder, your rank holder should come in the practice of patient care. Certificate. When that remains in a certificate, that is not a good knowledge. So there is a need to bridge gap between the knowledge and practice needs to be reduced. That needs to be kept in mind among the budding nurses who are going to enter in the profession.
Thank you, sir. Thank you so much for this wonderful interaction. Thank you so much for your time and for this interaction.
For more updates, subscribe to our channel, click the links shown on the screen to stay connected.